Good afternoon, everyone. We'll get started. On today's briefing, we'll hear from Milwaukee County Executive David Crowley, Mayor Tom Barrett, Dr. Ben Weston, Director of Medical Services for the Office of Emergency Management, and Dr. Jeanette Kowalik, Commissioner of the City of Milwaukee Health Department. I know it's a busy afternoon, so thank you all for joining us. And I'll kick it off with County Executive Crowley.
Thank you so much, Catherine, and good afternoon to everybody who's joining us. Over the weekend, as everybody could have seen, Wisconsin's seen a dramatic and positive COVID-19 cases. We've seen 926 confirmed cases on Saturday and 769 cases on Sunday statewide. And I know shortly we'll hear from Dr. Weston about our local numbers. But as we talk about these numbers, these case numbers, they are concerning. And I'm going to say something that nobody wants to hear, but we are clearly nowhere near done fighting this virus. So we must remain vigilant and continue to follow the recommendations of our public health officials on what we need to do to minimize the spread. And so I would like to first say thank you to Mayor Barrett and the Milwaukee Common Council for unanimously voting on the Milwaukee Cares mandatory masking legislation yesterday. Research shows us that wearing a mask is one of the best ways that you can minimize the spread of COVID-19. But it only works if everybody does it. We can't just have select folks deciding to follow these types of guidelines. And the city mandate will help keep our communities healthy and hopefully will help address the increase in community spread that we continue to see among those between the ages of 18 and 39. And I respect the city for making the investments in masks so that it can be equitable and accessible to everyone in our community. And again, I cannot stress this enough as we continue to talk about masks, but Milwaukee County does not have a health department. So we cannot mandate a countywide mask mandate, but we are requiring folks to wear a mask inside Milwaukee County buildings and facilities. We're starting to see individual municipalities like Shorewood, Glendale, City of Milwaukee, they begin to mandating these masks, and we want to applaud their actions. We also want to encourage all municipalities to come together to create a single county strategy as it relates to a masking policy. It is extremely confusing to everybody when we have different municipal guidelines. So it'd be good to get everybody on the same page. And when we talk about masks, I know that there's a stigma on wearing a mask, especially when you're out with friends and people asking, oh, well, why are you doing that? You're one of those people. We can't continue to shame folks for protecting themselves and protecting those around them. Wearing a mask should not be stigmatized. And we all need to combat this type of sentiment and behavior. So please, let's make sure that we continue to normalize wearing a mask because this is the best tool that we have right now to minimize the spread. The other thing that we have is testing. And testing remains a critical factor for us to help control the spread of COVID-19. And it's good to see that we've seen so many folks going to our National Guard sites to actually take advantage of the testing sites. And so yesterday we've seen about 1,473 people go to UMOS and about 704 people go to the Custer testing site. So we want to continue to encourage folks to get tested. And if you don't want to go to a National Guard site and you want to make sure that you are getting the proper care, please call 211, visit their website, or call 211 to find a testing site near you. And when you do get tested, please be prepared to answer, a call from the local health department. Whether you're positive or negative, they're going to make that call. And so it's important that you speak with that public health officer so they can do their job and keep our community safe. If you test positive, it's nothing to be ashamed of. And please don't go without information of who you've been with. If we want to stop the spread, we need to make sure that we're following up with public health officers and letting them know who we've had contact with. This is extremely important. And this is the only way to make sure that we can help with the contact tracing. They want to keep you safe, your family safe, and our families healthy. But we can't do that without the information. So please, if you are contacted, share that information. And then lastly, I just want to share some of the community resources and events that will be taking place. So if your family is in need of hygiene products, you could definitely stop by Owens Place tomorrow on Fond du Lac. They're giving out free resources between 4 and 6 p.m. And this Saturday, there will be 2 different bike drives, one happening at King Park and the other one happening at Kosciuszko Park. And that will be from 9 to 5. The bike donations will be distributed on a first come, first served basis. And if you're interested in those resources, please visit the website wecarecrew.com. Again, the website is wecarecrew.com for more information about these events. With that, I will hand it over to Mayor Barrett. Thank you.
Thank you very much, County Executive Crowley. And as the County Executive mentioned, the City of Milwaukee Common Council passed yesterday an ordinance requiring people to wear masks when they are outdoors if they cannot maintain a distance of greater than 6 feet, and in indoor business requirements. Indoor business establishments. Less than an hour ago, or about an hour ago, I signed this ordinance into law. It will go into effect on Thursday, and I'm sure the commissioner is going to talk about it. But I want to just take a minute and talk about it in context of where we are right now. Today's July 14th, and it was Friday, March 13th when we had our first case. So it was essentially 3 months ago yesterday that we had our first case, or actually 4 months ago yesterday we had our first case. And now today we've recorded our 360th death in Milwaukee County. We are at over 14,000 cases and over 11,000 cases right here in the city of Milwaukee. And of those 11,000, close to 9,000 are people of color. So this has had a disproportionate impact on our Latinx community as well as on our African American community. Individuals who are far more likely to be out there working because they're deemed essential workers and are at much greater risk. And I'm very, very aware of the fact that masks are viewed by some as a political statement, a political issue. But from my standpoint, nothing could be further from the truth. I would prefer that we didn't even have to address this issue. But here's the reality we face. Just this morning, New York State added Wisconsin to the list of states that it is requiring visitors to quarantine for 14 days if they visit the state. In other words, if you're from Wisconsin and you want to go to New York, you have to be quarantined. We were added along with Minnesota, Ohio, and New Mexico because of the positivity ratings that we're having right now in terms of a high percentage of people who are tested positive for COVID-19. We're seeing it in the numbers. The numbers are rising right now. And so we have not been successful in flattening the curve to the extent that we need to flatten the curve. Obviously, we've taken steps and we've done that in a measured basis to try to get businesses open. But if we're going to continue to have the businesses open, then we as residents have to take additional steps to make sure that we can be out in circulation. And as I was thinking about this ordinance, as I signed it and was getting questions from the press, and someone asked about those individuals who don't like it, I couldn't help but think of three, and I've had many, many, many people talk to me about masks, most of them in favor, some opposed, but there were three that jumped out at me right away. One was a woman whose son, who's approximately 20 years old, who has some health issues, some chronic health issues. And she had asked me to get this done for her 20-year-old son. The other was a gentleman whose wife has, again, a series of long-term health conditions. And he has to work from home and doesn't want to come into his office because he's afraid that he will, in some way, contract something and share it with his wife who has these issues at home. Or another individual who stopped me whose elderly parent is sick. What every one of these individuals had in common, every single one of them, is they were asking us to institute a mask policy, not for themselves, but for someone they love. And I think sometimes we forget that this is not about you, it's not about me, it's about people in our community. And so I want us to be a community that treats other people humanely. And you might be 25 years old and Superman or Superwoman or Mr. Invincibility. But the fact of the matter is right now, the age group that has the highest incidence of COVID-19 is 21 to 30. We started out, it was 50 to 59. Now it's essentially dropped 20 years. And so while it may not be as serious a condition for you as it would be for someone who's over 70, for example, whether you're symptomatic or asymptomatic, you may still be out there spreading this. And so what I'm asking people to do, and we're not doing it in a heavy-handed manner, we're doing it through the health department, is to wear the masks. Again, obviously when you're out in public and you can't socially distance for more than 6 feet, or if you're in a business establishment, this is important stuff. It's important stuff so that we can as a community, get back to normal. And we have to do it because the economy has been really smashed. Obviously, people are suffering economically. We're seeing evictions rising. This is one of the steps that we can take, that we have to take to try to get us back, get our footing underneath us. So the testing's important. And as the county executive said, we're seeing a lot more people testing. I think that's very, very, very good. Unfortunately, and Dr. Weston can speak to this, we're seeing the numbers rise in terms of the percentage of people who are testing positive. And we're not seeing more cases simply because there are more tests. We're seeing the positivity rate rise as well, which is not a good omen because it tells you that the disease is not shrinking. It's probably spreading throughout the community. We continue to do our outreach in the community with our webinars. We had one this morning with restaurants who are grappling with how to make this work. And we had over 100 restaurant operators who are trying to find out how to do this in the way that is safe for their customers, for their workers. And that is something that's very, very important as well. Finally, just to touch on this, we're going forward with our Safe Vote plan. Households in Milwaukee will receive a card about absentee voting both for August and then for November. This is by far the safest way to vote, but we will have many, many voting sites open. In addition, we're increasing the election day pay for workers from approximately $130 to $230 because we understand that there's, in essence, a hazard pay here component of this, but we need more election day workers as well. So if you're interested, contact our election commission. So a lot going on, but we've got a lot of work to do, but I'm convinced as a community, if we come together and act as a community, we're going to obviously get through this. So with that, I'm going to turn it over to Dr. Weston.
Thank you, Mr. Mayor. Good afternoon. First, as always, to our numbers, we've had 14,478 confirmed cases of COVID-19 in Milwaukee County and 360 individuals who died. We continue to see a terrible worsening burden of disease across the country with extremely high positivity rates across really the entire southern half of the country and the West Coast, particularly Arizona, Florida, South Carolina, Mississippi. At the same time, we're seeing trends towards similar numbers in many of the Midwestern states, including Wisconsin. Here in Milwaukee County, we are seeing an uptick in our positivity, but overall, we're thankful to have remained fairly steady for now. At the same time, we've seen states and cities across the country pull back on their reopening plans, and in some cases go backward in their phasing, closing down that which was recently reopened. Here in Milwaukee County, we must be mindful that despite our steady course at this point, change can happen at any time. Therefore, this is the time to maximize our opportunity to maintain our trend and prevent an increase in disease burden and the backstepping in our reopening process. Our economy and our health as a community are tied together. For that reason, we must be proactive in our approach to our health, rather than waiting for our situation to get worse. The city and some of the municipalities, as discussed, have begun to take the important and commendable steps to implement mandatory mask usage in higher risk environments. This is a critical step. As individuals, we all must assess our daily activities and minimize those that cause greatest risk. Think of the activities that you do each day and consider how you can modify them to decrease the number of people with which you closely interact. So yes, you need to go to work perhaps, but likely your meeting doesn't need to be in person. Your children may need childcare, but they may not need all the normal summer camps, sports, other activities that they've done every other summer. Yeah, you can visit with extended family outside from a distance, but you may be able to cancel your dinner party with other friends. And yes, you have to wear a mask in some situations where 6 months ago, you probably wouldn't have. These are small sacrifices that we all make at this time to ensure that we minimize the number of our community members and our loved ones that are forced to make a much larger sacrifice with their health or even their lives. This is a time where we must all make sacrifices for the common good. We can maintain the flat rates of disease, but we must be proactive and we must be thoughtful. We will continue to provide community-wide efforts to slow the spread of disease, and each individual must do their part as well. Thank you and stay safe, and I will hand it to Commissioner Kowalik.
Good afternoon. Thanks, Dr. Weston. As Mayor Barrett noted earlier, we met for the signing of the Milwaukee Cares or MKE Cares ordinance, which requires masks or face coverings for residents in the city of Milwaukee. Essentially what this means is whenever you're outside of your house or wherever you live, you need to wear a mask. We know that there's been a lot of questions about what about this, what about that. We know that there are some people that will be exempt from wearing the masks if they have various health conditions, whether they be physical, mental, emotional, or other, there would be some exemptions for those people. And we also know that children under the age of 3 are not required to wear a mask or face covering. We're looking at where children are at developmentally of being able to put the mask on and take it off safely. So just reiterating the importance of masks. I know that there has been a lot of questions about who do you wear the mask for, and honestly, I think that has caused some, I don't know the best way to say it, why some people may not be so sold on wearing masks, because they may feel that, well, I don't have the virus, so why would I wear the mask to protect others if I happen to have it? We do know that there are many people that are asymptomatic that don't know that they have the virus. So if more people wear the masks, then that's a way for us to contain and reduce the spread of COVID-19. So it's a gesture of goodwill and being a team player for our city. We're hopeful that other jurisdictions in the county will be able to pass these similar ordinances, such as Shorewood, which was the first to do it last week. But we do know that this is a very low cost, low risk action that we can take to prevent the spread of COVID-19. So like right now, I'm wearing a cloth mask. It's cotton, it's washable, good for the environment. There's many other types of masks that are on the market, so we're getting questions on what is ideal. And we do know that many people in our community may not have access to masks, which is why we're very happy that the council and under Alderwoman Demetra Vage, under her leadership, and Mayor Barrett have supported the health department's need to create a plan to provide free masks to our community. So that is extremely important, because if you think about it, if we put out an ordinance or policy out and then we leave it up to everyone to figure out how to follow it, that's not fair. So we're working on using a variety of funding sources and resources that we already have relationships with vendors and whatnot to provide a variety of free masks for our community. The Mask Up MKE initiative has been going strong. So we do have many of those available, and we have been handing those out. We do have those masks in a pouch. It's like 3 in a kit that we are handing out at our health department locations, and many other community partners are distributing those as well. We do know that Rebel is also committed to making or providing additional masks that are cloth, that are washable, which is great. But we are working on procuring a number of other mask options that are high quality and that will be available to the community. So since these acts just happened, we're in the works right now. Our procurement office has right now 140 vendors that have submitted their proposals to do business with the city. So we're looking at a variety of ways to meet the demand. We know that we have almost 600,000 people in the city. So we're assuming that if we could at least have one for everyone, but we also know that there's people that don't have the resources or the income to be able to have a week's worth of masks. So we want to have more on hand so that we can provide a kit, if you will, of masks, including educational materials and outreach for our community, so that we're really meeting the need, so that those that really want to embrace this culture change that we have in our city and in our area, that we're able to do so. It's also going to create an opportunity for local business to participate and develop relationships with the city to be able to manufacture and distribute masks. I know that there has been many small businesses that have been reaching out, a variety of different patterns and colors and different ways to express yourself. But as the mayor noted, wearing a mask isn't a political thing. It shouldn't be a political thing. It's a human thing. It's a way for us, again, to move into this new normal that we're still able to do some activities with restrictions or limitations, or we alter the way that we go about doing them. So that's why it's important for us to acknowledge the importance of this ordinance as a policy measure, as a way to save lives, as a way to prevent illness and disability, and some of the other effects that happen when one is sick and down, not being able to work for a couple of weeks, and how that can hurt financially as well. So there will be frequently asked questions document on our city website. We have .gov/coronavirus, and then we have Milwaukee.gov/MMFS, Moving Milwaukee Forward Safely. Those are resources that we update on a regular basis, so please use them so that you can get credible, up-to-date information. So the FAQ will be located on our websites as noted. Also, you can access the masks by calling 211 or emailing us at askcovid19. That information is also available on the website. Also, I wanted to just highlight some concerns that we have received from people about recreation and athletics and contact sports and wearing masks. So reminder, City of Milwaukee is still under orders. Phase 4 order prohibits contact sports. The only exception is for professional sports teams that have submitted a plan and has been vetted and approved by the health department. So pretty much only one group has that exception right now or approval, and that's the Milwaukee Brewers. The reason for that is they have a very comprehensive plan that includes screening, testing, and a variety of other features. We know that because entity may have the resources to be able to have such an aggressive response, that they can box in COVID-19 if someone happens to have it. We do know for many other intramural or casual or other rec sports teams, there may not be the bandwidth to do that type of screening and testing, which is why we're very concerned about some of the activities that we've learned about or witnessed ourselves through the health department staff that people have been playing. And it's great. We the health department, we want you to be healthy. We want you to practice physical activity and exercise. But knowing that COVID and the way that it's spread by being in close contact with another person, and then also the mechanism of breathing, which matters. The high exertion, the heavy breathing that comes with a lot of sport versus it being more like just normal breathing or not labored breathing, that with the forceful breathing, that's like, super soaker, you're getting possibly exposed to high concentrations of COVID-19. So this is why the mask ordinance does state that if you're exercising, you need to wear a mask. We do know that there's many people in our community that are runners or work out solo. If that's the case, then you're by yourself and no one's around. You don't need to wear a mask, but you definitely need to continue to disinfect and wipe down any surfaces that you may use while you're working out. And then another point I want to address is related to something that the county executive said, as well as Dr. Weston. So as a public health professional, on behalf of many of my colleagues, we have been seeing changes in the way that people are responding to us when someone is positive for COVID-19 and we're reaching out and we're asking for information that either we're not getting response or we're getting ghosted or anything like that, that we're seeing more of that. And that's extremely problematic because as we're trying to slow this down, we need cooperation from the public. We do understand we're the government, and sometimes just by being government or affiliated with government, there may be some mistrust or concerns about how we're using your information. But I just want to just stress again that we need information based off of the situation. We're not going to ask for socials. We're not going to ask for your checking or savings account information. The things that matter most to us is where do you work if you do work, if there's anyone else in your house, so anyone else that may be exposed because you're positive for COVID-19, or you may be a contact of someone, you may have been exposed to someone that's positive. And we want to make sure that you're getting tested and you're monitoring yourself for symptoms if they do happen. Isolation and quarantine orders are legal documents, and we've been partnering with the Milwaukee Police Department and now, within the Health Department and others, that we will continue to issue isolation and quarantine orders. So we just need to just stress the importance of this, of maintaining and following through and doing all of our parts as much as possible. And we noted again that there's people that don't have places to live and don't have stable housing or safe housing. So we do provide housing options for people that don't have them. By calling 211, you can access housing options in our area. So we have Clare Hall, and then we also have some hotels that we have arrangements with that will provide some temporary housing. But our goal is not just a patch. We do look for permanent housing solutions for our community. And then lastly, I wanted to say this because, again, there's been a lot of talk about younger people that have been pretty much the bulk of cases, not just in our area, but everywhere across the country. And just because our initial focus was people over the age of 60 or 65, people with health conditions, and then eventually middle-aged folks, and now it's younger folks. So we're ringing the alarm yet again that if you are a young adult, meaning under 30, a teenager, that you can be exposed to COVID-19 by hanging out with your friends, kicking it, going to parties, all of that, and not having distancing. The 6-foot piece is really important. Wearing a mask is really important. And, again, it's just a culture change that we'll have to make here in our area to really help with the spread of COVID-19. I saw this morning about Miami, how they're seeing more younger people in the ICU and, more complicated disease management. And, just because you get COVID and you think maybe it's like the flu or another cold that, oh, I'll be good in 2 weeks or a week, you don't know what damage will be done in the long term. Recovered is a loaded term. It can mean many things. It could just mean that you've taken 2 COVID tests and they're negative, but you could still have various damage to your organ systems, or you may have developed some type of cardiac issue now, or lung issue, or diabetes, or something like that. So to be such a young person and gamble or create more challenges for your health is not wise. So I just want to appeal to our younger audience to just really focus on protecting yourself and protecting your loved ones from COVID-19 by distancing, keeping 6 feet from other people, and stepping up your hygiene, hand washing, using the alcohol sanitizer, 60% or greater content. And then, of course, wearing a mask. And wearing a mask properly from the top of your nose to the bottom of your chin, that's the way for it to work. If you have your nose sticking out, you're not really wearing, it's not going to give you the full protection. And then when you take the mask off, you need to make sure you're taking it off and not possibly infecting yourself if there's any viral material on the mask. And then using the mask like you would handkerchief. That's like old fashioned or old school for someone to have a handkerchief, but you normally don't just keep reusing it after you have material on it, then you use a fresh one. So you want to get into the habit of making sure your mask is fresh. There are disposable masks, like the Mask Up MKE ones, and then also there's many paper surgical mats that are out there as well. But we recommend the cloth masks as a protective intervention for the community because it is just as good and it's going to provide some support. And the last thing I want to say is if you do have COVID, and I talked about isolation and quarantine orders, and maybe you found out you had COVID, but you don't have any symptoms, or your symptoms are extremely mild, please do not take it upon yourself to think that you're good and you're going to go out and hang out and expose other people. We have heard of some of these situations happening, and it's very disheartening because one could be exposed to COVID. You may not have symptoms and think you're good, but you can expose someone else and they can die from it. So just really being mindful of other people. And my thing for younger people, and I've said this in the past, it's like, if you can't think about other people, always think about one other person that you love and care about that is older than you, or maybe in a different situation as you. And you wouldn't want to lose that person because someone felt oh, I'm good, I'm gonna go to this bar, or I'm gonna go to this party, and possibly take someone out because of my selfishness. So we can do better. Again, it's just knowledge, having access to resources, and then of course, just knowing what the lay of the land is here, sticking to the fact. We're providing updates on a weekly basis on how we're doing. We still have our Friday updates, although now we will not move into phase 5 unless we have all green for the 5 indicators. So that's a big change, something to definitely watch. We'll continue to put out media alerts every Friday with our specific stats for the city of Milwaukee. So thank you.
Thank you, Commissioner Kowalik, and you've actually answered a few of the questions that are here in the chat already, so that's great. We'll move to the Q&A portion of the briefing, and our first question is from Matt Smith with WISN, and he'd actually like to ask the question of our guests himself.
Hi, all. Hope you're doing well. I actually have 2 real quick questions for you. First one for the mayor and the commissioner. We've heard from a number of delegates from out of state that they are still planning to travel to Milwaukee for the convention, despite the DNC staying home. What's your advice to them? Do you want them to stay away? And will any DNC event at this point require masks to be worn?
I'm assuming that all DNC events will require masks to be worn because you're not going to be able to operate within 6 feet. So that certainly is the assumption I'm making based on the ordinance that we signed today. I think if individuals come here, they're coming here obviously on their own volition. I will say that it's interesting right now that the 2 cities that we were in competition with for the convention, Houston and Miami, are both experiencing incredibly difficult times right now. And so as difficult as it is for us right now to deal with this pandemic, the 2 other finalists for the convention, Houston and Miami, are facing much, much, much bigger and more serious numbers. So that doesn't mean that we're out of the woods, as we've said earlier. But again, I think that's going to be an individual decision. I honestly think we're still essentially 33 days away, or roughly 33 days away from the convention. A lot can happen between now and then. And I'm hoping that it happens for the better, but I can't guarantee that. Again, I look at those same numbers that Dr. Weston looks at in the southern states and the western states, and that's why it made it easier for us to make the decision that we had to have that mask ordinance here, because we have to take whatever proactive steps are necessary to make sure that our numbers don't spike. So I think there's still a lot that can happen between now and then, and I certainly hope it's all happening for the better.
And then, Commissioner, that's a yes on the masks too, from your perspective, that they will be required?
Right, since it's an ordinance, wouldn't be exempt from that. I know that the DNC has put a lot of energy into their plans, and I believe I noted this last week. Any details related to how they're going to roll this out, that's all embargoed right now, so we're not allowed to discuss it. But we are in regular discussions with the DNC planners because, obviously things have changed quite a bit from not having to worry about a pandemic to having to worry about a pandemic. So definitely DNC will look differently this go around, but we are in close contact with them about how things will look once we get to that week in August.
And Dr. West, you hit on this briefly. In the state briefing just a few minutes ago, state officials seem to say that we really need to roll back our attitudes and our behavior in terms of no outside barbecues, no drinks with friends. From your perspective here in the county, is that the guidance you would like to advise folks to do, and Commissioner as well?
I mean, I would say it goes beyond the county. I think as a country, that is what we need to start doing. I think everybody needs, like I said, everybody needs to consider each of the events they do every day. We've talked about people, space, time. How can you modify your events for that? So yeah, unfortunately, having friends over in your house for dinner, it's just not something that is safe to do right now. Everybody's making sacrifices. Some people are making far, far greater sacrifices than anything we've talked about on this call or anything we're recommending. So I think wearing masks, changing your activities is a sacrifice that everybody should be making.
I agree. There's a lot of excellent activities that you can still take part in this wonderful Milwaukee summer. So it's not like we have to be cooped up in the house. Honestly, getting outside and getting some fresh air is good, not just for your physical body, but for your mental health as well. But, I see, this past weekend, even going by the lakefront, definitely looked a lot better this past weekend. It wasn't as intense as it was in prior weeks. But it's even like going to the beach, like just keeping your space from other people. We know some people, have roommates or they have a big family. So whoever's in your household, that's, you're in your household, and that's what it is. But it's the point of being exposed to people outside of your household that is the concern, because you can quickly be exposed, and then everyone in your household could possibly be compromised. And we know that there's people that we love dearly that may have various health conditions or are older age, and we just again need to be mindful of others as we embrace this new normal. COVID's not going anywhere anytime soon, but we can still do things to bring some pleasure and joy in our lives, but still do so in a mindful manner.
All right, thank you. Patrick Polantonio with WISN has 2 questions. The first is, the Brewers season is scheduled to begin next week. What does the mask mandate mean for Major League Baseball in Milwaukee? Will Brewers and their opponents be required to wear masks during practice and games at Miller Park?
Yes, so we have been in contact with the Milwaukee Brewers, and I just noted that, we've approved their plan. So their plan, obviously, when they're playing is not to wear masks, but we are fine with that because of the screening and testing. I mean, the intensity of the screening and testing provides an ability to isolate if someone is positive for COVID-19. When you're looking at average Joe or Jane or person in the community that is not aggressively going to get tested and screened, and then they're interacting, and it's not just those people that are playing against each other. You have to look at the bubble, like who all else are they associated with that also is aware and limiting their interactions with other people. That's the problem. You can be very mindful about your movements and wearing your mask and distancing from other people, but if you're playing a game with someone that's just like, living it up and living on the edge, that's not wearing a mask or being mindful or thinking that COVID's a big deal, they may have the virus. So all of the work that you're doing is null and void, because now you've possibly been compromised because that other person isn't taking additional precautions to know their status, that they're getting tested on a regular basis with the community testing sites. I know like yesterday, UMOS had very high numbers. Our Barack Obama site still has good engagement, but the numbers between UMOS and Custer Stadium or Barack Obama are like night and day. If you have the transportation or the ability to head to the north side, go to Barack Obama, they have more openings than the UMOS site. So we also know that there's a lot of other opportunities to get tested in the community. So we just again want to promote, use Google Maps, put in COVID-19 test, and it'll tell you where you can get tested in the area. We know that there's a lot of people that have been trying to get tests, but all of the appointment slots are full at like many of the area private pharmacies and some of the hospital or healthcare providers. So knowing that we always have these free options, that you don't need an appointment, you can just show up, is really important. So I just want to steer people to Barack Obama, Custer, because they tend to have more availability and not the value that the UMO site has.
Thank you. And Patrick's second question is for County Executive Crowley. He asks, if the county does not have the authority to issue a mask mandate, is there discussion with other Milwaukee County municipalities to issue mask mandates on the local level? And are you encouraging all Milwaukee municipalities to issue mask mandates?
Great question, Patrick. I can definitely tell you that many municipalities are having that conversation. That conversation was just discussed yesterday during one of the ICC meetings. And Milwaukee County wants to continue to be a leader in this. That's one of the reasons why we were the first to institute a mandatory mask policy for all of Milwaukee County buildings and facilities. And so we're going to continue to encourage and support all of our municipalities here in Milwaukee County to coordinate some type of mask policy so we can have, hopefully we could have one county message.
Just to piggyback on that, as the county executive said, the ICC, which is the Intergovernmental Cooperation Council, had a conversation yesterday. It was a discussion item only about the wearing of masks. And each of the suburbs will be in a position to decide for themselves whether they want to move forward with it. So I imagine as there's more media attention that is brought to this issue, that there's going to be more interest both for and probably some interest against having the masks in these areas. But if you look around the country, if you look around the world, this is something that's becoming pretty prevalent. I see where England has just reversed its policy and now requires people to wear masks when they're out shopping. And that's a sharp reversal for the attitude that they've shown up to this point. So I think the reason this is happening, again, tragically, and this is not something that I enjoy, and nobody enjoys any of this stuff, is because the numbers and the people suffering from this disease continue to grow. And that's a serious issue.
Thank you both. Our next question is from Emily Files with UWM, and it's for Dr. Kowalik and Weston. She says that MPS announced it will most likely start school virtually and bring students back to classrooms in phases depending on the health situation. What parameters do you think MPS should use to determine whether to bring students back? Some teachers are advocating for a 14-day period of no new cases before an in-person return.
Yes, so we have been consulting MPS on their plan. It is up for review at the school board meeting on Thursday. So we will have our deputy commissioners on hand to provide some expert guidance and additional support if anyone has specific questions to various components of the plan. So the point of thinking that the 14-day open window is like a pathway moving forward, I would challenge that, because again, as you have to look at the testing situation. You have to look at the positivity rate and seeing where we're at in that regard. If you can really see that the testing is where it needs to be, then you could probably be confident in a 14-day window. If it's, we're looking for less than 5%, right? Like that's the goal here. And we've been teetering 10, 12, now 9, it's been altered a little bit, which shows that you just see the fluctuations in people getting tested. So I'm happy that more folks are interested in knowing their status and getting tested. But for children, again, we're happy that more kids are getting tested. Initially, the focus was just on older folks or people with health conditions. But now that we're seeing more children getting tested, that's important. We also understand the safety concerns of staff and faculty, because many of our teachers and teachers' aides and other professionals may have health conditions or be of older age, and we don't want them to be exposed or be in harm's way. If you're a parent, that kids they can get sick or be exposed to various germs, and then you can get it from them. So we're very mindful of that. We're very concerned about that. So just, to answer the question again, yes, we have been consulting them on their plan. We do know that there are some serious concerns about how this is going to roll out. Some of the concerns that we have are related to even the facilities and the buildings. Some of the structures are older, the HVAC systems are not as current as others, and that might be create a risk for exposure if you're looking at airflow in rooms and things like that. So we are in talks, and we have to just continue to monitor the situation as it gets closer to the fall.
Excellent. Anything to add there, Dr. Weston?
No, I think that was a great summary. It'll certainly be a dynamic situation regardless of what the gating criteria ends up being.
All right. Virginia Small, a freelance reporter, has our next question, and it's for County Executive Crowley and Dr. Weston. She says that 2 players on the Milwaukee Milkmen team have tested positive. Games are continuing to be played at the Rock in Franklin. Have there been any discussions about this situation? The Rock's website lists Milwaukee County Parks as a partner.
Yeah, so I can just say that I know the Franklin Health Department has been very engaged and has been monitoring the situation. I think the most important thing is like we talked about before, to continue to as an individual, consider what sort of situation you're in. How close are you to the people around you? Are you wearing masks? How long are you in that situation? Is it open air? All these different factors. And I know Franklin Health Department's been engaged.
And I guess to add on to that, so that ballpark is not owned by Milwaukee County, and we don't have any jurisdiction over that ballpark. And so, just like Dr. Weston said, you have to focus on that city of Franklin public health official, but we don't have any jurisdiction over that.
Thank you both. Our next question is from Graham Kilmer with Urban Milwaukee, and he asks to Commissioner Kowalik and Dr. Weston, do you think bars and restaurants should still be open?
Well, just to start too, like again, noting that the city of Milwaukee has an order in place, that there's still an occupancy restriction that is set up to make sure that there's additional distancing. We know that many operators have participated in our sector-specific webinars, and the Wisconsin Restaurant Association even has an opportunity that they're going to provide free masks for bars and restaurants. So while supplies last, but again, I noted this at the press conference earlier that being able to provide patrons with a mask if they don't have one is a better option than saying, oh, well, you can't come in here, you don't have a mask, figure it out, where that might create a more hostile response. So equipping operators with masks for those that don't have the supply, but for those that do have the resources, having some on hand that you can give out to your customers is really important. We also have the option in the city of Milwaukee where we have this COVID safety plan or risk mitigation opportunity. So it's still underway where we're reviewing many restaurants and bars and considering them to not have any capacity limits because they're following this recipe. They're sticking to this very tight protocol to prevent the spread of COVID-19. And our health department staff that are reviewing those plans and going out and doing the inspections are trained by the CDC. So they have this higher level of support that they can give to our local business owners and operators. So I think the concern or the question about do we think bars or restaurants should be open as normally, like pre-COVID? No, but with additional safety precautions in place, educating staff, educating patrons, requiring masks, having spacing and cleaning high-touch surfaces and screening. And there's a lot of things that can be done to mitigate the spread of COVID-19. And the last thing I want to note is the active streets proposals that we've been receiving, and I'm seeing them pop up, or we're seeing more places that are not doing indoor dining or bar service, that they're doing things outside. As long as the spacing is where it needs to be, that provides some additional support with the mask wearing. So, that would be my response. The way that things were pre-COVID, no. But post-COVID with the modifications, we still have these restrictions in place for those that aren't a part of that pilot. But for those that are and are approved by the health department, we are comfortable with them being open because they have the recipe for success.
All right. Hannah Jewell with Fox 6 has what I believe is our last question. If anyone else asks questions regarding masks, I might have skimmed over them if they were answered, but if you need the response on camera, please make sure to chat me. Hannah's question is for Commissioner Kowalik. When do you know it's time to toss or wash your face covering, whether surgical or cloth?
Yes, so as far as if you have a paper mask or like the Mask Up MKE, that various different material that they use for those masks. So disposable masks cannot be washed, but may be used in a 5 to 7 day rotation to allow any viral matter or particles to become non-viable on the outer surface of the mask. I have seen a variety of like MacGyver type strategies where people can like steam them in the microwave and all this stuff. I'm not recommending that. I don't know if that works. It hasn't been scientifically tested to my knowledge, but I know that people are trying to do or take some additional precautions to prolong the life of masks. But if you have a cloth mask, which again is best because you can wash them and it's good for the environment, is that you're supposed to wash these coverings once a day by hand or machine wash using detergent. The face covering needs to be dry before using it again. And that's really important because if it's moist and it can create an opportunity for you to get an infection, or you see that they have this new articles out about people developing acne from their masks. So you want to make sure the mask is fully dry before using it. But personally, like along the way, I was able to pick up a variety of masks. So I have my stash for like 10 days. So I just kind of throw them in the wash with everything else. But that's what we're trying to do again for the city, is provide our community with free masks. So not just one, but we want to have more so people have a rotation. We know some people don't have a washer and dryer in their house or in their apartment building and have to go to the laundromat. I mean, you can always wash in the sink because it's something small, but we do know that some people have limitations in laundry, so we want to make sure there's enough so you don't have to go like every 2 to 3 days.
Thank you. And our last question is from Mark McPherson with CBS 58, and it's for Dr. Weston. I know, Dr. Weston, you've provided some context in the chat. The question is, how long does it take to get results back from the National Guard sites, and why the delay? Specifically, Mark is looking to hear about that, what the wait time is to get results.
Yeah, so the National Guard testing sites are run through the state, and all the test processing, and I believe, at least in the city of Milwaukee, Commissioner Kowalik, the notification of positive patients is done through the National Guard. And so I know there's variable times of how quick the results come through, but we have been working with the state to try to expedite that so that patients can get their results as fast as possible.
And I can add a little bit to that as well, that there's some additional planning activities underway to provide more of like a strike force or strike team approach to testing, so that we would be able to stand up testing sites along the way. And I know that depends on whether it's like an employer-based outbreak or just we see like a high concentration of cases in a certain census tract or neighborhood. But we want to make sure we're providing a variety of testing strategies along the way. Remember, earlier on, there was a limit in access to testing. We didn't have enough testing kits, so they had to be triaged. And now that there's more testing kits on the market and there's more access, we want to create more opportunities. So again, it's great that our community is stepping up to get tested, and that we're seeing the numbers that we're seeing, but definitely more process improvement is needed so that the lines are not, and I said this before, redonkulous, where people are waiting hours to get tested. So, and we know how difficult that is in the summertime too, when you're running your car and your air and all of that too. So we want to keep working on improving the flow of those testing sites.
All right, thank you all. I know it's been a long afternoon. Those are all the questions I'm seeing, so we appreciate your time today, and we'll see you on Thursday. Take care.